The reason I got into orthopedics is in retrospect, I had a bad injury as a kid, and I think at that point, that was my first real exposure to the field. I thought in no way, shape, or form would I want to do that for a career, but in looking back on it, the doctor who treated me then, he became someone I emulate, or someone I looked up to and admired, and I think sort of helped kind of carve my path for my career. A specialist in sports medicine, I tend to see mostly shoulder, knee, hip, and elbow disorders. That makes up about 95% of my practice. In the shoulder, I think the most common injuries I'll see are either rotator cuff tears or injuries to a labrum or a biceps, by far and away probably the most common. In the knee, I see everything, whether it's a simple meniscus tear to advanced arthritis. In my experience with the trauma division of Hughston up at Skyline, I see a lot of multi-ligament knee reconstructions. So I tend to see the whole gamut when it comes to knee and shoulder injuries. And then for the hip, I do a lot of hip preservation surgery, whether it's a labral repair or removing portions of bone to help someone get better range of motion and function in their hip. And then also in the elbow, I treat a lot of overhead athletes, whether it's Tommy John reconstructions or other elbow arthroscopy procedures. I think our toys are getting way more advanced, so the implants that we're using to fix people, the technology is just growing, it seems, every day and every week. Specifically with what I do, I think robotic surgery has really changed the game for us, and it's made outcomes better, it's made surgery more efficient. We're using a lot of image guidance and MRI and CT-based implants to help treat patients. I think also the use of biologics, whether it's stem cell treatments or platelet-rich plasma, where you can take someone's own body tissues and help them heal, that's come a long way, especially in the last 5–10 years. Hughston Clinic's an interesting place to work. I really enjoy it here. It's almost like you get the benefits of an academic center without being in an academic center. We have a multi-specialty group here. I work very closely with the trauma division of Hughston up at Skyline Hospital, where we take care of patients with a variety of very severe injuries. And so we have a lot of intermingling between different providers, whether it's something that I specialize in better than somebody else, and we always seem to find a provider within the group that's the best able to treat a specific injury. So we have a very nice collective group of subspecialists, and if someone has a very specific injury, we always find the best provider to treat that.